Okay, we're going to get started. Good evening, and thank you for joining us tonight for what I know will be a very interesting presentation, certainly very timely. For those of you who are new to us, the Women's Wellness Fund advocates for, educates about, and funds priority women's health projects in our community. We have a wonderful steering committee who help to plan our activities and our presentations, and they've really dedicated a lot of time and energy to ensure that we put our good programs on, and I'd like to thank them for all of their time and energy. I'd also like to thank all of you who are members of the Women's Wellness Fund. I appreciate you sticking with us this year, as it's been very difficult to try and figure out a way to keep everyone engaged, and I think we've struck a good chord with trying to do these webinars, and certainly by the number of people who are on tonight's presentation, it seems to be working. But I hope in short order we can get back to meeting in person, maintaining social distance, but still getting to see one another live. I think will be a good time for everyone. Certainly the work that we do in the Women's Wellness Fund is very important, and we've made a lot of great strides on our projects. And I'd like to turn things over to Sarah Moore, who's going to describe a little bit more about the projects that we've been involved with and what's coming up in the future.
Thanks so much, Laura. Hi, everyone. If you don't know me, my name is Sarah Moore, and I'm the Development Director for Middlesex Health. And I'm going to just give a quick report to everyone about what we funded last year with the help of our members and our sponsors. So the first project that we did was to identify women at high risk for cancer. And we did this by purchasing some technology to screen women during their mammogram appointment. And we do about 23,000 mammograms every year at 3 different locations. And I'm happy to say that we now have this iPad screening tool in use in Middletown, and we hope to push that out to other sites soon. The second project that we funded with your help, or actually I should rephrase that, the second project that we are looking forward to funding is a new center for integrative medicine and wellness. And this is relocating our current center to a new location so we can expand our offerings in the areas of massage, Reiki, acupuncture, and more. Right now it's within our cancer center, but it's open to all patients and community members. Unfortunately, the project was put on hold due to COVID and a ban on non-essential healthcare construction. So as soon as we're able to resume that project, we've held some funds over from our donations from last year to put toward that project. The third project that we supported last year was a genetic testing study. This was also in the area of our cancer center. And the idea is that we may be missing genetic mutations in cancers with the current guidelines. So we're part of a national study with Mayo Clinic to investigate this further. And we're looking to add 300 patients to the study. We're more than a third of the way there. And 66% of the participants today are women. So we're really excited about that being part of this groundbreaking research. And then finally, a program that we funded in the past is the Perinatal Social Work Program. And this is connecting women who are facing major challenges with resources in the community, women who are pregnant, I should say. And so this year, or actually last year in 2020, we served 102 clients. And that was a real uptick in the number of women that we were helping. And really the issues that they needed help with were basic needs like food, helping to obtain supplies for their infants, whether it was car seats or diapers, that sort of thing, as well as mental health and substance abuse issues. So that's what we did last year. We really appreciate those who are able to support all of those last year. And I'm going to move right into this year and what we're looking to fund this year. So in 2021, we are looking to upgrade our equipment in the Pregnancy and Birth Center, and that will be our infant incubators as well as hospital grade breastfeeding pillows, those boppies. In the past, women would bring their own. We want to provide one that can be thoroughly disinfected in light of the current situation. Our goal for that project is to raise just over $21,000. The next project is a technology to pinpoint breast cancers during surgery. And for some of you who have experienced this personally, you may remember having a wire inserted into your breast to locate the area of your tumor for the surgeon to remove it. This new technology would replace that And with the placement of a seed, something that's almost like the size of a grain of rice, and then using radar, the surgeon is able to locate precisely the area that your tumor is located and be able to remove it, as well as any lymph nodes that need to be removed. So we're really excited to be adding this project, and it really improves recovery time and side effects for patients. And the goal there is to contribute $15,000 to the overall project. Next up, we are going to continue our partnership with the Middlesex County NAACP. They are continuing their health equity study, this time with a focus on the Latino and Latina population, and we are helping them fund a focus group with Latinas about women's health. And our goal there is to give them $4,000 for that study. And then we'd like to fund the perinatal social work program one more time with $5,000. So overall, we're hoping to raise $45,000 this year with your help. And you can help us do that by becoming a member or renewing your membership if you're already a member. That starts at $100 or more per year. The benefits is that you get invited to 3 health talks like this. Our hope is to go back to our usual format where we meet in person, we dine together, we have a glass of wine, and then we learn some good information and meet new friends, hopefully. 100% of what you donate goes to the project that you'd like to support for that year. And if you're interested, this is our website, middlesexhealth.org/Women's Wellness Fund. So that's it about the Women's Wellness Fund. We want to get right into our talk. And before I get there, just a bit of housekeeping. If just as you're looking and you want to make sure you see the slides and the speaker, enter the full screen in whatever device you're using. And then if you want to ask a question, you can post your question at any time using the Q&A icon in your menu on Zoom. And then we will get to the questions at the end of the presentation. So I'm really pleased that Dr. Alina Filozov is with us tonight. She is the chair of Middlesex Hospital's Infectious Disease Department. As you can imagine, she's been incredibly busy over the last year and has an incredible amount of knowledge about all sorts of infectious diseases, including COVID-19. She chairs our antimicrobial stewardship program, and she is the hospital epidemiologist. So you're in for a lot of information. Please ask questions. And without further ado, I would like to introduce Dr. Filozov.
Thank you, Sarah. Thank you. Thank you all of you guys who joined me today to discuss vaccines. I'm hoping to convince all of you today that along with antibiotics and hand washing that was discovered many, many years ago in the last 2 centuries, that vaccines are one of those vital part of healthy and long living, without which, all the other advancements in our medicine, such as chemotherapeutic agents and everything else, would not have been possible. Because if somebody dies in their childhood from measles, they don't live long enough to see the benefits of all the other ones. So we're going to go through routine vaccines first, and then we'll end with COVID vaccines, and hope there is some time for questions as well. The next slide, please. So all vaccines, whether it is 2020 or 1918, go through all the clinical trials. It's the variations in the clinical trials. It depends on the urgency of the vaccine, and usually those phases take several years to complete. And part of the problem in going through from one phase to another phase is obviously financing and also finding subjects. So every clinical trial starts with a research on animals. Once it is determined that the medication or the vaccine, in our case, has the potential of being a safe and effective therapy, it goes through stages where there are more and more participants, where we're looking for the lowest effective and safest dose to achieve our results. Now, in the past year, that usual phasing continued to happen even for the COVID-19 vaccines, although it happened sometimes simultaneously. For example, phase 2 and 3 happened at the same time, and also phase 4 happening very shortly after phase 3. There were clearly no problems with financing, and there were clearly no problems with subjects, because to find thousands and thousands of patients who are willing to enroll in these trials was never a problem since the start of this pandemic. So you could see that EUA happens after phase 3, and we have at least 3 vaccines under emergency authorization, which is when it comes to the COVID-19 vaccine, which we'll talk about later. But normally the FDA approves the vaccines after a phase 3, and then there is a phase 4 where there is a long-term data that comes around. Next slide, please. And so every year, CDC comes out with recommendations. So all providers receive these emails, and it comes through CDC. So on the left, you see the list of most common vaccines. And then on top, you see the age groups. Recommendations for all adults when it comes to vaccines. Next slides, please. Next slide. Okay. And those recommendations are also changed. Okay, we skipped a slide, but that's fine. Those recommendations are also changed based on your risk factors. So if you look at the world coverage, we can go forward with this as well. When you see of the world coverage of vaccines in 1-year-olds, you can see very good coverage, and when it comes to measles, tetanus, polio, over 80%. So that's really great news. Not so much for the second dose of measles and Haemophilus. But when you do vaccinations in infancy, after birth, several months after birth, up to a year, usually most children are completely compliant with those immunizations. But if we look for at adults, next slide, please. If we look at the adults, things are a little different, or a lot different. You can see the highest coverage for vaccines is about 60%. So when we look at the tetanus, which is something that is very routine, it has to be, and it's recommended for every adult every 10 years, you can see that not even 65% of all adults in the United States are covered by tetanus. If you look at, again, the highest one is pneumococcal vaccine in those who are 19 and 64. But these are not great numbers when it comes to coverage for vaccinations. That means that even for illnesses that are occurring and reoccurring every year, there are rates of vaccination are not perfect, and that's why the epidemics continue. If you look at the influenza, and influenza is in this right here, 40 to 45% of all adults in the United States are vaccinated. So that leaves the vast majority of adults not vaccinated, and that's why we have epidemics and pandemics of the flu every year. Next slide. Now, what's the story with the vaccine? So the word vaccine comes from a word vaca, or which is a Spanish or Latin for cow. And it came from the days where the cowpox was used to prevent smallpox. And that's really, in essence, is how do we provide immunity to an illness without causing an illness? Because as you know, there are only two ways of developing immunity from certain infections. Either you have the illness itself, and then you have most likely a lifelong immunity, or you have a vaccination. Now, for most of the infectious diseases, it's not really advisable to experience all of them yourself. So clearly we have vaccines that will prevent it. And this is a very complicated chart here, but in summary, we want to create immune cells, and immune cells come in two different forms, in the forms of antibodies and forms of T cells. They all have different functions, but they all work together. You need both to have a proper protection against infectious diseases. And at the end, once you deliver a vaccine into somebody's system, at the end, we're looking for memory cells, both memory B cells, memory T cells, and memory what's called killer T cells. They're exactly what they sound like. They're there to prevent any infectious agents similar to what the vaccine was priming them to stop in their track. Next slide. And the purpose of vaccination, large number of people in a given society, is to create herd immunity. So this is just an example of herd immunity for any illness. So if you see those little things in green, those are immune vaccinated people, and those are in blue, unvaccinated. So you can imagine, let's say there are a couple of unvaccinated people in the sea of green. Even if they can transmit infection to one of the green or two of the greens, that infection will not, that infection, I'm not sure why the slide are continuing to move, and I'm not sure it's the problem on my side or on the other side. Could you please go
Dr.
back?
Filozov, that was my mistake. I'm so sorry.
Okay, okay. I know it's technically challenging, but so everything that could go wrong is going wrong. So I apologize, and I'm sorry. That sequence of infection would stop if you have a large number of people who are vaccinated. And the more infectious the agent, the more people you need to get to the herd immunity, more people need to get vaccinated. And some of the problem is some of the people cannot be receiving the vaccines because they have contraindications. Somebody has personal ideas about vaccines. So the more people we have on the plus sides with the vaccinations, the less likely we have outbreaks. Next slide, please. There are several types of vaccines. This slide only counts for 3, but with the invent of COVID vaccine, there is obviously more than 3. So when you have a live attenuated vaccine, that means that you're creating a very light illness because we're giving you a weakened live virus. And these vaccines create the best immunity. So it's as close to having an actual vaccine, actual disease as it can go. Next slide. When we talk about inactivated vaccine, we are inactivating either bacteria or the virus by special agents. And again, you have developing the same kind of immune response, but it's not as robust because it's not as urgent because the virus or bacteria is not live. Next slide. And then finally, we have subunit or conjugate vaccines. Those vaccines are just parts of the virus or bacteria, and they manipulate it in a certain way to create the best response possible. Next slide. So with COVID vaccines, we have other technologies. So under number 1, we have something that a lot of us are excited to, and we're waiting for that vaccine to come to market. It's made by Novavax. So they produce an actual spike protein. So your system doesn't need to even make any foreign agent. They give you spike protein, and then your antibodies are forming as a result of that. Under number 2 is your type for J&J vaccine or Astrazeneca vaccine when we have adenovirus, and we'll talk about it in detail a little bit later, which actually makes the spike protein and then antibodies. And number 3 is our mRNA vaccines. Next slide. So in mRNA vaccines, the genetic material in the virus, in the COVID-19 virus that is used to make the spike protein is purified, and the spike protein is selected because, and the spike protein are those little buds on the virus itself, and without the buds, it cannot attach to the human cells. So if it cannot attach to the human cell, it cannot cause the disease. So we felt that they felt that this is the best target to create the vaccine. So they take that genetic material and then they prepackage it because it's in the form of RNA already, because it's an RNA virus. They package it so it doesn't fall apart, and then they inject it. And then our system from mRNA developing a protein that is used to create little tiny spike proteins that cannot be on their own cause the disease or cause viral infections particularly. And then as a result of that, our immune system is developing response towards that spike protein. Next slide. And every time we have these discussions, to vaccinate or not, whether it's COVID or whether it's tetanus or any other illness. We always look at benefits and the risks. And anything you do in life is about benefits and risks. When you take a trip in the car, when you fly to another state, when you buy something in the store, there's this benefits and the risks. When you take a prescription for an antibiotic, your doctor is thinking, what are the benefits? What are the risks? So compared to all options, so there is nothing, no things is 100% safe. There is always a risk that is associated, but compared to other risks, vaccinations are very, very low risk entities. Next line, next slide. So when it comes to mRNA vaccines, and this is real-time data, out of out of the millions of cases of mRNA vaccines given already, there was a rate of 4.5 cases per million doses. To compare, flu shot causes side effects at the order of 1.4 per million, pneumococcal shot, pneumonia shot, 2.5 per million, and the old shingles shot was 9.6 per million. And regardless, these vaccines were very, very effective and very safe. And if there is a problem like anaphylaxis, which is a very severe allergic reaction, there are treatment options. Next slide. And just as a comparison, so Haemophilus influenza, it's something that is immunized. All children get immunized with this vaccine. It can cause a little bit of a fever. It can cause some redness at the site and maybe pain. But look what on the upside or downside, if you have the disease, it will cause. It would cause meningitis and permanent damage to the brain and mental retardation potential and epiglottitis, which is difficulty breathing, and that could be a fatal condition as well. And it can cause pneumonia and a joint infection and bone infection. And again, weighing the risks of the infection versus the benefits of this vaccine, I think the choice is clear in this case. Next slide. So when we talk about vaccines for women, there is not a single vaccine that is only recommended for women. Most vaccines or all vaccines are recommended for all adults, whether women or men, but there are some benefits for women to receive some vaccine. And those benefits may be related to fertility, for example, vaccines against HPV and mumps. Those vaccine infections can threaten survival of the fetus or health of the fetus. Your MMR, measles, mumps, rubella, or varicella, which is chickenpox, or can cause severe disease in babies and can be transmitted by mothers like pertussis or whooping cough. It can also, some infections can cause severe disease in pregnancy and non-pregnant women like influenza and pneumonia and COVID and meningitis and hepatitis. It can lead to severe symptoms such as shingles, and it can place some travelers, high risk activity people, whether it's by occupation or by leisure, at risk for severe infections. Next slide. So going over a few of the routine vaccines. So HPV vaccine initially was created for women, but it is now recommended for both boys and girls, and up to the age of 45 that is approved by FDA. So the benefit for women from HPV vaccine is the prevention of the cervical cancer, vaginal cancer, vulvar cancer, prevention of the genital warts, and anal cancer. And that benefit in regards to the genital warts and anal cancer also benefits men as well. So CDC recommends that all 11 and 12-year-olds receive the 2 doses of HPV vaccine 6 months apart. There is also coverage for men or boys as well, of that age group. The side effects are usually mild, and it's well tolerated other than just soreness of the site. Next slide. The next is MMR vaccine. It is very important as of lately to make sure that everybody at least has some evidence of immunity to MMR, because we've had outbreaks of measles, which we have not had for decades, and due to the waning herd immunity, as we were recently talking about. So if you were born before 1957, we assume that you had measles naturally, because that was the time. If you have a documentation of MMR vaccine, if you have titers in the blood,
we take it as a proof of vaccination. Any other stories, my mother told me, or it's in my chart, will not go. For a funny story, I lived all my life thinking that I had chickenpox. I don't know where I got that, but I told everybody, don't worry, I got chickenpox. And then as I was coming, I can remember, I think medical school, they were checking my titers, and I've never had chickenpox. So that just proves it that, you know, sometimes memory is not correct, either mine or my mother's. And so you have to have the proof, especially for these illnesses like that. Next slide, please. Another important thing is pregnant and immunocompromised patients cannot receive MMR, and that's because MMR is a live vaccine. So measles, mumps, rubella covered by the MMR vaccine. So we're giving you a weakened live virus, and therefore when you have a low immune system to begin with, you can actually develop measles, mumps, or rubella as a result of the vaccination. So to protect the people who are immunocompromised, people who live with them, people who travel outside of US where measles outbreaks, let's say in Philippines, there has been years of measles outbreak, contact with immunocompromised patients, people in secondary education should have 2 doses of the MMR vaccine. Next slide, please. So back to benefits and risks. So if you don't have MMR vaccine and you do develop measles, and I did see adults who develop measles, and this is not the same illness as in children, but even in children, 1 in 5 people who don't have measles and who get measles get hospitalized. Children. So when I say children and women, anybody who get measles can develop pneumonia. You can develop encephalitis, which is inflammation of the brain. It can cause seizures. It can cause death. Obviously, when you're pregnant, it can be a much severe, and you can have a premature delivery of the baby or a low birth weight. Next slide. Mumps affects women as well. It can cause sterility, both in women and men, but since we're talking about women, it can cause oophorytis, which is ovarian inflammation. It can cause sterility. It can cause pancreatitis and encephalitis, and meningitis and deafness. And you know that there are outbreaks of mumps on college campuses lately, and some people are getting even 3 doses of MMR to avert the decreasing immunity over time and decreasing number of vaccinated people. So that's so mumps part of MMR is also very helpful. Next slide. And then finally, rubella, finally in terms of MMR, cause multiple intrauterine damage to the infant. In the pregnant woman or a woman who is not pregnant, cause severe arthritis. Usually it's really a medical emergency if a pregnant woman does develop rubella. Next slide. Varicella is a chickenpox. Again, it's a live virus, so we cannot give it in pregnancy, people who are immunocompromised. And chickenpox was considered one of those, mild illnesses, and people have chickenpox parties and had immunity naturally. But the disease has its risks. There is a secondary risk of infections, including group A strep, and group A strep causes the toxic shock-like syndrome. So that's very scary when a child or an adult develops this. It can cause pneumonia and meningitis and sepsis. And in children, any kind of variations like that can really cause hospitalization and bad outcomes. Next slide. Tetanus. Every 10 years, everybody should get tetanus. But right now, I'm going to focus on the pertussis part. So there are 2 different tetanus formulations. One is the tetanus, and one is tetanus diphtheria, TD. And the other one is tetanus, diphtheria, and pertussis. And pertussis is the whooping cough. So whooping cough is increasing in frequency in older individuals, men and women. We are now need to not only protect the older individuals, but also protect the children from the caregivers, because If a child, an infant, gets pertussis, there's a very high chance that they will not survive that because it's really severe illness. Now, tetanus the same. So you can see a photograph here of a bone-breaking muscle problems that happen as a result of tetanus. And that should not happen this day and age because we have very excellent preventative measure. So now all pregnant women in their third trimester receive Tdap. All people around the pregnant women also get immunized as well. So to make sure that the risk is decreased. Flu shot, anybody who is 6 months and above should receive flu shot. Even if you have allergies, whether you have allergy, egg allergy, severe or not severe, it is still recommended that you use a regular flu shot. Yes, there are some formulations that are egg-free, but overall, there is safe options in the current with the current flu shot that is available everywhere. However, if you do or somebody does develop a Guillain-Barré, which is a paralyzing condition, within 6 weeks of the receipt of the flu shot, it is not recommended that you have another flu shot, at least not of similar mechanism of action, because if there could be a repetitive action. And unless the risks are very high, you should not get re-immunized. Next slide. Pneumonia shot is one of those popular shots, especially in those 65 and above. So 65 and above, you need to get one of the pneumonia shots at least. So there are two, one called P13 and the one is P23. That's easier to remember because the names are very similar and can be confused. So P13 is called Prevnar and P23 is called Pneumovax. And so at the age of 65, you should get at least the P23 or Pneumovax. If your doctor and you decide you need to have the P13 as well, then you get that first and then P23 a year later. Next slide. However, if you are immunocompromised, then you should get both the 13 and 23 because your risks are much higher. And who do they call immunocompromised and chronic medical conditions? Those who have alcohol abuse, those who are smokers, and chronic other diseases, heart, liver, lung, diabetes as well. Next slide. Shingles vaccines, again, are very popular. And this is not a fatal illness, but the purpose of the shingles vaccine is to really prevent the outbreaks, which can happen on different parts of the body and very often it happens on the face, which causes really debilitating pain. So the reason for recommending shingles vaccine is to decrease the outbreaks or to eliminate the risk of outbreaks and decrease this risk of pain, which is called post-herpetic neuralgia. You can see that the new shingles vaccine, which is called Shingrix, it is so much better than the old Zostavax, even to the point that CDC recommends that if you have the old Zostavax, continue to still go and receive your new Shingrix vaccine. So if you're 50 to 69, you should get your 2 doses of Shingrix and it's going to be 97% effective. If you had it at the age of 50 and you reach age of 70, it's still 91% effective. And you have not had these kinds of numbers with the old shingles vaccine. And the same, very similar numbers to prevent the neuralgia or the pain that can really change people's lives as a result of those shingles. Next slide. Hepatitis A is a vaccine that is now routine for all children born in US. It used to be purely travel vaccine, but we've had outbreaks of hepatitis A in homeless population related to some food sources. So people who have HIV, chronic liver disease, for whatever reason, hepatitis C, B, alcoholic liver disease, fatty liver disease should get hepatitis A. Gay men, drug users, homeless people, travelers, people who work with infectious agents, or sewage, those should also be getting hepatitis A. Next slide. Meningitis vaccine comes in 2 forms, a regular meningitis vaccine and meningitis B. because the regular meningitis vaccine does not cover type B of meningitis, which is appears to be increasing in frequency, especially in college-age kids. So it is recommended that all children of all genders should get the meningococcal vaccine at the age of 11, 12, then a booster 5 years later. So at least at the age of their college time, they're still covered. And then they should be discussing the also type B vaccine that is available in almost all pharmacies. And other people are at risk as well for meningitis. And anybody who has seen or suspected meningitis in their loved one or in the patient, you know, this is a very scary disease. Within hours, somebody goes from live and well to not returning to life anymore, because this is a very severe and rapidly progressive illness. The next slide, sorry. And finally, in regards to the regular vaccines, typhoid vaccine. Typhoid is not very common in the United States. Actually, it's uncommon completely in the United States. So usually people who are traveling should receive this vaccination. It protects against salmonella, that cause of invasive disease. In older women and men, it can cause inflammation of the blood vessels and severe outcomes. And typhoid itself can cause seizures. Up to 30% of people will die as a complication of the typhoid. Try this vaccine, to try this illness on your own. Vaccine is very safe. It is available in an oral formulation and injectable formulation. And we have it in our travel clinic as well. Next slide. So now moving on to the COVID vaccine trials and women in those trials. So you can see that out of the trials for Pfizer, Moderna, J&J, nearly half of the recipients of those vaccines were women. And AstraZeneca, there were 60% of women. For Novavax, this vaccine is, that information is not yet available. Next slide. Why is it important to be vaccinated against COVID in women? And part of the problem, even though women in general do better with COVID than men, for example, there seems to be information that there is more long-term side effects associated with COVID in women in their 40s and their 50s. So a couple of studies from UK show that you have somebody who had maybe a mild illness, and then afterwards there are long-term problems, even in those patients who had no underlying health conditions. Next slide. I'm not sure the delay is on my side or on your side, but
Dr. Filozov, I think it's on your side.
okay, that's why I'm quiet, because I'm just waiting for the slide to advance and I didn't see the slide, so I apologize.
That's okay.
So it didn't advance yet though.
I did advance it. Are you not seeing it?
No.
Okay. So it's the real life data of Pfizer vaccine and how large the study was.
Oh, okay. So when you compare to numbers of the effectiveness of the Pfizer vaccine, the real life data from the countries that have large number of population vaccinated really mirrors that data from the trials as well. So it is really protective against both symptomatic and asymptomatic infection. It is really protective against severe infections, against the hospitalizations. And I'm trying to remember what else was on the slide. I mean, this is so frustrating. I'm sorry.
So then we're on the next one, which is the impact of COVID-19 vaccines on asymptomatic infection.
Okay, so there is a lot of discussion whether it protects, the COVID vaccine protects you against any illness or only illness that is causing severe symptoms. So this Mayo retrospective study looked at everybody who came from some type of procedure, and they looked at those patients, whether they are vaccinated or not, and to see if they were accidentally would find positive COVID infection in those. And they saw many more patients who were positive in unvaccinated cohort of patients than not vaccinated. So it suggests, although this study is really skewed, you can see there, they used so many 45,000 of tests in unvaccinated patients and only 3,000 tests in vaccinated patients, but at least based on this current data, it suggests that it should be protective. Those vaccines should be protective against asymptomatic infection as well. Next slide. And it also should be protective against the variants. There are multiple data, including antibody, including T cells, that both Pfizer vaccine and then Moderna vaccine, and then J&J as well, protects against multiple variants with different effectiveness. Next slide. Side effects of the COVID vaccines appear to be more common in women. So even though we are encouraging everybody to get the vaccination, we need to prompt it by saying that there could be side effects, and seems to be in one of the studies, 62% of women who received the vaccine had side effects. Of course, women are more likely to report those side effects than men, but it's still a significant number. Next slide. Johnson & Johnson is 72% effective in the United States, but that's not what's important. What's important is that it is preventing 100% of hospitalization and death. And it also what's important that it's 86% effective against severe disease. And it has protection against multiple variants as well. Next slide. The side effects are very similar to mRNA vaccines. Next slide. Astrazeneca vaccine, as there's a lot of discussion in Europe about the benefits and the risks of it. They are applying for FDA, EUA in the United States. We'll see what happens there. But at the moment, it seems to be 76% effective in the United States. Again, it has 100% effectiveness against hospitalization. And it seems that there is a very good efficacy in those patients over 65. And this is one of those vaccines when you have a DNA put in the adenovirus, and adenovirus enters the cells, and ultimately it creates spike proteins that are used by the immune system to recognize a foreign agent. Next slide. Novavax vaccine uses a moth cell to produce spike proteins. And so once they purify those spike proteins, they really inject into the human subjects. The similar process occurs, and it seems to be very efficacious against all kinds of diseases, including very severe disease, and against the UK variant, which is 117, and not as much, but still very good efficacy against South African variant, which is 1351. Next slide. When we compare the vaccine, we have to take into account not just the overall efficacy. This is just only one little point. But when was the trial done? Was it done at the height of the pandemic in 2020? Was it done in 21? Was it done in US? Was it done in Europe? Was it done in South America? Because that means that different variants played a role in the illness and protection against the vaccine. You need to know whether the trial included men, women, people of different races. Now it's very timely that whether it's included immunocompromised patients and children, what kind of dosing, whether it's convenient dosing, is it 2 dosing, is it 1 dose, what kind of side effects happens. And then the really important number is the efficacy against the serious outcomes. And when we say that this vaccine or whichever vaccine is 95% effective, we're saying it as a group. So in a trial, that 95% addresses the protection for that group of people who receive this vaccine, not for an individual person, because all of us have differences in our immune system. We are different age, we have different weight. Men tend to have lower immunity as a result of the vaccination. Women tend to have much higher antibody responses. People who are more obese have much less decreased immunity as a result of the vaccine. So there is a lot of little tiny factors that are as important as the number of the effectiveness. Next slide. Now, the most recent data on pregnant and lactating women and those who are not pregnant was compared. So this is a small study, but looking at the Moderna and Pfizer vaccine, those patients who were pregnant or were breastfeeding seemed to develop the same immunity that those that are not pregnant. And the antibodies were found in the breast milk and in the placenta as well, which should be protective to the baby, in utero and afterwards as well. Next slide. The COVID vaccines are very, so there is the big push for COVID vaccine is not just to prevent death, but to prevent the long-term outcomes. There are multiple studies showing that many months after the COVID infection, even if it is mild, but especially if it is severe, you have scar tissue in the lungs, you have symptoms that persist for months and months. You have patients who are not returning back to normal, sometimes 3 months after their illness. The most common side effects that can persist are fatigue and a headache and attention disorder. People describe brain fog, hair loss, dyspnea, difficulty breathing, lack of smell may not return, and all kinds of other things that we cannot describe very well. So that's why the importance of the COVID vaccines. Next slide. So to respond to this, NIH is looking at what that's called a mega cohort of patients who are having long-term effects, and they're spending some money, which is nothing. 1.5 billion over 4 years is really very small amount, but I'm hoping that there will be additional investments into this very long problem, because you can imagine the number of people out of millions of people, including in US, who have had an infection and may be suffering from long-term effects. We're going to be, we have to know how to take care of those patients. And so this condition is now called PASC, post-acute sequelae of SARS-CoV-2 infection. So we're hoping that with new research, we will know how to help those patients better. Next slide. Okay, so we made it to 6:50 with interruptions. And again, I apologize for all these technical difficulties.
And Dr. Filozov, I was going to ask Sally Ann Lee to ask you the question, so you don't have to monitor that. So go ahead, Sally.
All right. Well, thank you, Dr. Filozov, for your very informative presentation. And we do have a few questions. Currently, they're all about the COVID vaccine. The first one is, what is your advice for parents who have children aged 16 and 17 in regards to receiving the COVID vaccine?
So as you know, Pfizer vaccine is approved for 16-year-olds. Right now, at least in Connecticut, it is not yet open to everybody, but it will be open. Vaccination will be open to everybody, every adult, including 16-year-olds and above. I do recommend that people, children, and parents do consider vaccinating. We do see that with variants, the disease, or this past few weeks, we see increasing numbers in the disease in between 20 and upper 40-year-olds. We see patients young and older in very severe condition coming into the hospital. And in order to stop the spread of the variants, and in order for the children not to experience not necessarily COVID-related complications, directly viral-related complications, but inflammatory changes that happens as a result of COVID, something called MIS, which is in old times, if somebody who maybe had Kawasaki syndrome, which is a type of inflammation that young children would develop. And this is very serious, and this is much more dangerous to children than actual COVID. So I do suggest that when it is available, that you do consider vaccinating your children, especially since children in high school are those among all children probably are the highest risk of getting a problem.
Thank you. The next question is, would you recommend a young woman of childbearing age to get the vaccine? someone who's breastfeeding and someone who's pregnant?
Yes. Yes. So even in the early trials, even back in late 2020, when Moderna and Pfizer reported their results, even in that trial, there were people who got pregnant during the trial. They didn't have increased miscarriages, because I know there's a lot of talk on different social media that it can cause miscarriages or trouble with fertility. There is no evidence that there is a fertility problem whatsoever. We do see, obviously, there is an antibody production. This antibody do not cross-react to any other tissue in the baby or in an adult. So based on the most recent data, it is recommended that if you're pregnant well, what I would recommend, it's not when you're about to get pregnant, but if you're already pregnant, to consider the vaccination, and if you're breastfeeding as well.
Great, thank you. Another question is, how much of a problem will those who don't receive the vaccine and or allow their children to get the vaccine be for the rest of the general population?
I missed the first part, and I apologize again.
Sorry about that.
Very choppy connection here. Could you repeat the first part?
Sure. They're asking, how much of a problem will those who don't receive the vaccine and or don't allow their children to get the vaccine be for the rest of the general population?
Oh, well, it depends what kind of numbers we're talking about. So, as you know, with other vaccines, there are always people who cannot receive, let's say, live vaccines or, flu shots because they had Guillain-Barré. So there is always, but it's about the numbers. So if there are 40% of people who do not vaccinate themselves and their children, yes, we're going to have a problem. That means that we're going to be in this pandemic for another couple of years. But if we reach 70%, even we need higher, but if we reach 70%, it is very likely that we can return to normal life. Now, I don't know the background of whether at any point those vaccines will become mandated. I don't know that. Like, for example, a flu shot in healthcare workers in Middlesex Health are mandatory. Now, there is no indication that it will come in the near future with the related to COVID vaccines, but if it does come, you would have to make that kind of decision at that point as well.
Okay, thank you. Another question is, can you receive the second dose of the COVID vaccine if you have an active case of shingles?
An active case of shingles. I would not recommend, if you have an active case of shingles, receiving any vaccines. Now, the usual timeline between the first and the second vaccine for Pfizer would be 21 days. For Moderna will be 28 days, but delaying it for several weeks is not a problem for almost no vaccines. So adding some maybe 2 weeks or a week or 2 weeks or 3 weeks, whatever you need to recover from the illness would be best. Otherwise, you're not going to respond very well to the vaccine because your body is busy fighting another infection at the moment. So you do not want to introduce another type of sort of immune stimulation, number one. And number two, you don't want to have more robust side effects because, they're already risks for side effects. They're not, terrible, but, if we can diminish them, why not do that?
Thank you. Another question is, I have a cardiac arrhythmia. How does the vaccine impact this, and what may be the long-term effects if I get the vaccine and if I choose not to?
We have not seen any increase. By we, I mean we who immunize and from other researchers that are reporting the data that have not been a reported side effect. But arrhythmias tend to happen as a result of other conditions as well. So if you are dehydrated or if you have fever, you can develop arrhythmia. So they're not necessarily a direct connection, but there could be. So, and I would still, whether you have arrhythmia or not, that is not a contraindication to COVID-19 vaccine. The long-term effect of COVID, and it's clear, if you were to develop COVID, again, based on risks and benefits, having COVID disease and having arrhythmia will probably cause even more side effects for you or even more symptoms for you. So vaccine is probably the least of two evils, and I would still recommend that you consider vaccination.
Thank you. Another question is about, can you speak to the recent reports of infertility in younger people who get the vaccine?
There are no reports of infertility.
All right.
No credible reports of infertility.
Thank you. Our next question is actually about HPV, and it is, how is the age for HPV determined? Is this necessary for non-sexually active youth? And how late could one wait to have this vaccination?
So interesting and good question. So the age was determined based on the usual start timing of the sexual activity. And remember, they define sexual activity not just as sexual intercourse in a classic way. It could be oral sex. It could be, different types of sexual encounters. So the HPV vaccine is best to be given before any kind of sexual encounter. So that's why they chose, 9 or 11 or 12 year. Initially they said 9, but then more people probably selecting 11 and 12-year-olds to get vaccination. And can you wait longer? Yes, but what we don't want is to create a situation where somebody is already sexually active and then the HPV vaccine comes in later, but you're already exposed to those high-risk HPV strains that can cause cancer.
All right, our next question is, if you had COVID, would you still recommend getting the vaccine?
Yes, I would. So there are multiple research information on those on comparing patients. So there's somebody who had a little runny nose and at home. There is a big difference. The antibody production in certain people is minimized. If you had very severe disease, your antibody and immune response production is going to be much more robust. So to level the playing field, the vaccine makes those who had very small response to the COVID vaccine, to mild COVID vaccine, and those who had severe COVID vaccine kind of equalize it. And also remember, the vaccines, it causes sort of multifaceted response. We do see that it's not just related, even though it's supposed to be secondary to a spike protein. We see different kinds of antibodies to multiple regions of the spike protein. So even if that spike protein changes its not location, but the amino acids. It changes its configuration, that the vaccine will still remain effective. But with the disease, that cannot be guaranteed.
Sally, we've got time for 2 more.
Okay. Oh, man, there's so many. All right. How about so many vaccines? Is there a saturation point? What is the medical community doing to address media promoted by anti-vaxxers?
So there is no saturation point, because every moment of your life, your immune system is encountered by billions of different bacteria and thousands of different viruses, and you're not sick. And so adding another 10 to that armamentarium is not a problem. And what's the media doing to address the anti-vaxxers? Well, there are people who talk against the anti-vaxxers and to report inconsistency in the claims that they make. And we as doctors, anytime we see a patient who is hesitant to receive vaccine, we take our time and talk about it. And we hope that other people, talk to their loved one and family members too, to encourage people to get vaccinated.
Okay. And the last question is, what is the recommended time frame between shots if you have to take the following? And they list shingles, flu, and COVID-19.
Okay. So the COVID vaccine has to be given at least 14 days after any other vaccine. So, and then we have to take into account shingles vaccine that has to be done 2 to 6 months apart. So I would probably do the COVID vaccine and then finish the COVID vaccine completely, which is 3 or 4 weeks separate, then followed by the flu shot, and then followed by the shingle shot.
Great, thank you very much.
Thank you, Dr. Filozov. That was like a marathon. I really appreciate you working through the technical challenges. You were amazing. You offered so much information. So thank you so much.
Thank you, everyone.
We're just going to share a few closing remarks and ask for your feedback on today's session. So a couple of events coming up that we ask you to save the date for. These are Women's Wellness Fund events. We're hoping to get back to in-person events shortly. So the next one is July 21st on gender identity, and then October 28th about our guts. So please save those dates. More information will come out soon. And then we are doing a collaboration this year with the Ministerial Health Fellowship and the Middlesex County NAACP. And it's called Real Talk, Health and Self-Care for Our Times. This will be a free series. There will be 3 virtual talks and then an outdoor gathering on a Saturday in May. So again, we'll have more information about this. I just wanted to give you some sort of save the dates if you're interested, and look for the sign up soon. And then finally, we really do want your feedback about tonight's talk and about future talks that you'd might like to see us present. So the link is middlesexhealth.org/Women's Fund Survey. When you exit the Zoom, you'll also have a link that you can click on. And then again, just a reminder, these programs are offered for free to our members. We invite anyone to come as a first-time guest to check us out, but we do encourage you to become a member if you can, and you can visit our website to do that. My name is Sarah. This is my phone number and email address. You're welcome to give me a call if you have questions. Thank you so much. Have a lovely evening, and we'll see you again soon.
Thank you, Dr. Filozov. Bye, everyone.
Everyone.